Well, as far as my awareness goes, I think it was more the revolution for queer rights and things of that nature. I know Stonewall had occurred, and people were just tired. I know that I was in bars in West Hollywood in my youth and was subject to police invasions where they'd come in and just throw everyone up against a wall and make you pat you down and check your ID and take you outside, and just for no reason whatsoever. And it happened on many occasions with no warning whatsoever, and people were just getting tired of being subjected to that type of treatment. And I think the founding members were activists of that nature and wanted to start some type of movement to alleviate that prejudice. I don't think the reaction was any different then than it is now when people see us. Like their first reaction is, what is that? Or what are you doing? Or what are you? And I don't know the exact history of the whiteface. I've heard different versions from different members, different founding members even. But the version that I felt most strongly about was the fact that the whiteface represented the palette of life, and the things that we put on our white faces represent the strength that we bring to our lives and to others. Okay, basically the federal ADAP program is designed very strictly to assist people whose income is below what they consider 200% of the federal poverty level, which is a dollar figure that they dictate on an annual basis. And basically what that means is that if you make less than that on either disability or part-time work or whatever your situation might be, and you do not have any assets worth over certain thousands of dollars, like a vehicle cannot be worth more than $2,000. They have variable dollar amounts that a home can be worth, but the home's worth is also dictated by what your mortgage payment might be. So the guidelines that they have for the ADAP eligibility are basically set up to fund only the really, really poor. If you happen to be trying to maintain a job, or you don't want to divest yourself of the house that you worked 20 years for to save up to make a down payment, and you've been living there for 10 years and you have a mortgage payment that they consider to be too high, then you're not eligible to get assistance from them. And if you are still working, you may have health insurance at your place of employment, but because of the severe changes in insurance regulations over the last few years, insurance companies have randomly changed their copay coverage. They may have gone from a flat copay rate on a prescription of $5 to a copay that's anywhere from 5 to 20% to some of them are up to 40% of the price of the drug. And when you multiply that by someone who's taking HIV medications, a tripla may be one of them, which is $1,800 retail. Norvir is about $900. You factor in 20% of those costs, you're talking basically $300 to $500 a month as your co-pays for your medications. If you're making $2,000 a month, it sounds like you should be able to do that. But you also have to live at the same time. If you're making a mortgage payment of $800, you're making a car payment and buying food, lo and behold, you're running out of money. People who are still trying to maintain some degree of self-esteem by maintaining a job, or they may even have made too much money during their life and they get too much money from disability. So that's another thing that can throw you off. If you make over, I believe it's like $1,500 a month on your disability payments, then you're ineligible for other assistance. Yet if you buy the medications on your own, you don't have enough money with $1,500 a month. You have enough money to it becomes a choice between buying food and paying rent or getting your drugs, and people will logically opt to pay their rent so they have a place to live and buy food so they have a place to eat it. And they'll take their chances with the disease shortening their life or killing them quickly, or whatever the consequences may be from that. Basically, it's a very simple process. We are not regulated by any type of governmental guidelines. We created the program to work the way we wanted to. We take the same basic information. We need their proof of residency, proof of diagnosis, proof of income, and we do a short interview with them, basically just talking about what their current lifestyle may be. And because of the involvement that so many of us have as members of the Sisters out in the real community, in the real outside world, we have some knowledge of probably 80% of the clients from someone in our order somewhere along the line before we even really talk to them. But basically we utilize the same type of eligibility determinations that they do use at the governmental facilities, but we have the option of deciding that making $50 a month more than what the federal poverty level is not going to prohibit someone from getting assistance from us. We have clients who are undocumented, who are unable to get assistance from anyone, and we will take care of their medications for them. Our program is divided into 4 separate areas. We will do health insurance continuation for individuals whose insurance premiums have jumped from $400 a month to $1,500 to $1,700 a month, which is not extreme. And that's not an unusual case. It's happened to more than one client that we've utilized that has come to us. We also do insurance co-pays for medications if they have their health insurance. Obviously, it's better for us to pay for their health insurance and let them make their own co-pays if they can. But we will make co-pays for the individuals whose insurance co-payments are too high for them to handle comfortably. We also will pay for non-HIV drugs, which are items that are not listed on the state formularies. Those are also predicated by the governments of both the United States and the individual states. The U.S. decides what all the drugs on the formulary should be, and each state goes through those drugs and decides which ones they are going to consider to be on their individual formulary. The problem is that the states keep cutting down on what the formularies are that are accepted within their guidelines, and they're not taking into consideration the drugs that are required to counteract the effects of the HIV drugs. The side effects can be extremely detrimental to a lot of people. People may require things like prednisone for allergies to the drugs that they're taking, or they develop blood pressure problems or diabetes problems. You need cholesterol medications. None of these things are covered under the Nevada state formulary. So we will pay for those, whether it be full acquisition or a health insurance copay. And the other area that we cover is the full payment of HIV and non-HIV drugs for an individual. That would happen in the case of a lot of undocumented individuals, people who may have just moved to Nevada and are pending their transfer of Medicaid or their eligibility with one of the local community-based organizations for AIDS services in the Las Vegas area. So we will pay outright for their medications while they're waiting for their approvals. Fortunately, we've been able to link with pharmacies in the area, and they give us better prices than the retail costs. So